Alright guys, this is Diogo Trevisan. I'm here to talk about the shoulder again, a little bit of treatment. If you don't know, I did 2 other videos on the shoulder, a little bit of palpation, diagnosing, some biomechanics, anatomy. So if you want to know a little more about diagnosing and the clinical aspect of pain in the shoulder, go back to my other videos. You'll find it there easily in my channel. So today I'll be talking a little bit about the treatment. There's something I want to discuss that is very important. Okay, when patient has shoulder pain, there is a progression. There's phase 0, 1, 2, and 3. I'll be discussing them separately. Why do I call phase 0? Phase 0 is when the patient has so much pain that they are unable to do their activities. So they cannot bring the arm overhead, they have a lot of pain, they have difficulty sleeping, it wakes them up in the middle of the night. That's phase 0. What do you do in phase 0? Anti-inflammatories, period. Depending on how bad it is, it could be a cortisone shot, it could be ice, oral, non-steroidal anti-inflammatory drugs, NSAIDs, resting, light, soft tissue release, some stretching. Very careful because it depending on the condition. So that's phase 0. Phase 0 is a inflammatory control, anti-inflammatory. Phase 1, we start with isometrics. Now, this is a huge problem in rehabilitation, okay? Because people think that isometrics to build muscle and build strength. None of the above. Isometric exercises are not to build muscle, they are not to build strength. When you have severe inflammation, your tendons have micro lesions. The collagen type 1 is not aligned. They're all misaligned instead of having those tensile alignment. The alignment to receive tensile forces. They're all misaligned, which it makes you more prone to have micro lesions, to have injuries on the tendon. Okay, so what the isometrics will do, number 1 is soft tissue adaptation. So your tendons have to be stronger. They're inflamed, they're weak, they have micro lesions. Your body has to heal. That's why you go through a phase 0, an anti-inflammatory, and it has to remodel. Your tendon has to be strong again, aligned, strong. That's why you do isometrics. Okay, it forces the collagen type 1 in the tendon to realign. It pumps some circulation, like it improves the circulation. It'll pump the lymphatic system. That's the responsible for getting rid of the inflammation, the exudate, some of those chemokines, dead cells. So isometrics on phase 1, that's very important. If you start doing isotonics with weights, especially overhead, some people go straight to overhead and Olympic lifting with shoulder pain. That can really set you back. That can really worsen the inflammation because you already have an injury, you already have inflammation, your tendons are weak, your collagen type 1 is misaligned, you're not ready for that. Inflammation affects neuromuscular control through proprioception. If you have some intracapsular swelling, it'll affect your proprioception, it'll affect your form, it'll affect your neuromuscular control, and you're prone to have injury. If you don't have a full thickness tear, you may have one. Okay, so very, very, very important. Do not do isotonics, weightlifting before going through this isometric exercise. Okay, for you that don't know, that's watching the video, don't know, isometric exercise is just a contraction that doesn't produce movement. Okay, Raciel will be demonstrating isometrics right now. Second phase includes strengthening of the rotator cuff, very important, external rotation, internal rotation, empty can, front raises, side raises, and every variation of that. Now guys, I'm not showing a wide range of exercises because it's full of that on YouTube, okay? There are many amazing channels with amazing exercises. There are way too many variations for all of them. I'm just showing you the basics and variations of the same, okay? So external rotation, you can do sideways, you can do on your back, you can do isometrically, you can do with elastic bands, you can do on the cross cable in the gym.
Rush up the place. And make them all have fun. How we ablaze the fire, make it fun them. We mash up the place, turn up the bass and make some sound, boy run. And we will end your week just like a Sunday. We mash up the place, turn up the bass and make them all have fun. Skrillex ablaze the fire, make it fun them. We mash up the place, turn up the bass and make some sound, boy run. And we will end your week just like a Sunday.
You already went through anti-inflammatory phase, the resting phase, phase 0. So your shoulder already feels better, but your tendons are weak. You go through isometrics. Your tendons are now tighter, strong, a little more aligned. They can take a little more tension. You go to phase 2. Rotator cuff strengthening, front side raises. Make sure you progress slowly. You can start very light, 15 reps, 10 to 15 reps. Progress a little in weight. When the patients are not having pain, no discomfort, a little bit of discomfort is fine, but they don't have pain anymore, they can do front raises, side raises, all the external rotation. They can go to phase 3. Phase 3 is all the complex, compound, bigger muscles exercises. Bench press, pull downs, bend over pull downs, posterior deltoid, posterior raises, high pulls, name it, including overhead.
The bass, turn up the bass and make some sound, boy run. And we will end your week just like a Sunday. We mash up the place, turn up the bass and make them all have fun. Skrillex ablaze the fire, make it fun then. We mash up the place, turn up the bass and make some sound, boy run. And we will end your week just like a Sunday. If I not pose, but if I suppose, them see we are close, them wouldn't suppose. They killing the flows, but sicker than most. strong. We give them it rough, we give them it long, we give them it right and never yet wrong. Sweeter the victory, the hotter the buckle, the bigger the club, the fatter the buckle, the bass of the rockle, I might have a knuckle. It's road with this, mash up the place. Turn up the bass and make them all have fun. And we ablaze the fire, make it fun them. We mash up the place, turn up the bass and make some sound, boy run. And we will end your week just like a Sunday. We mash up the place, turn up the bass and make them all have fun. Skrillex ablaze the fire, make it fun them. We mash up the place, turn up the bass and make some sound, boy run. And we will end your week just like a Sunday.
On phase 0 and phase 1, where the inflammation is really bad, you have to avoid at any cost overhead activities. That's the most stressful one. Now, there is a lot of that being said, nowadays. Is overhead activity really bad for you? In my point of view, it's functional. The human body is perfect, it's functional. You may have a type 3 acromion, and overhead will cause you pain. If you're doing overhead strengthening and every time you do overhead it causes pain, but anything else you can do and it doesn't cause pain, you better lay off overhead activities for now. Check what type of acromion you have. Check if there's any underlying condition. See a professional, an orthopedic surgeon, a physical therapist. Get your shoulder assessed, because pain with overhead activities could be other underlying conditions. Spurs, type of acromion, chronic tendonitis, tendinosis, worth getting checked out. Anywho, you should avoid overhead activities. That should be the last thing you do. Only when you don't have any more discomfort, you have enough strength, you feel nice and tight, your tendons are stronger, you don't have inflammation, you go through phase 3. Very important, this step by step. Like I said, if you progress too fast, people that do their own rehab, they start with compound exercises, the bigger muscles, especially bench press and overhead. Very stressful on the short and long head of the biceps, supraspinatus, even the external rotators. If you go straight to that phase 3, it can really set you back. You can actually end up with a full thickness tear. If your shoulder is extremely severely painful, is not getting much better, please look for a specialist. Get assessed. It can be very complicated. Orthopedics is full of details. This video is just to give you an idea. I really hope it was helpful for you rehabbing your own shoulder, or healthcare practitioners, just to help you to think, in phases. What are you aiming right in the beginning when the patient is really bad, and how you progress was the clinical thinking to progress your patient to stronger exercises. That works in post-operative rehabilitation as well. Okay? If you haven't subscribed to this channel, subscribe. Give me your feedback. Email me your doubts. On my Instagram, message me. I'm here for you guys. Let me know what you think. Like this video to receive more. YouTube sends you more of the same when you like the videos. Thank you so much.